healthcare environment, helps you get used to patients, touching patients, giving a patient their first bath is kind of causes anxiety for people. But if you're in a nurse aid program or a tech program, that really helps you get organized and gets you really exposed to the type of work you're going to be doing, okay? And some people will decide, yeah, this is great, this is what I really want to do. But then they also have to decide, you know what, I'm not cut out for this. I need to do something else.
Can you explain what a prison nurse is? Like, what do they do?
A prison nurse? Well, just like any other place, you know, prisons have people that get sick, okay? And most big prisons actually have small hospitals, okay? And, you know, the local prison here, like Stark County, you know, jail and that, they bring their patients to our hospital, you know, but many big prisons, you know, they just have a small hospital and they take care of the patients there.
Well, like when it says it's like incredibly hard work and not for the faint of heart, what is that?
Well, what it means there is that you're going to be exposed. Obviously, people in prison haven't done very good things, okay? So you're going to be exposed to people, different personalities, people that aren't very nice, may say things to you that, you know, that are real appropriate. So that's kind of what that means, okay? You've got to have really thick skin, okay? Okay? Any other questions?
Thank you, Bert.
Thank you. Thank you.
I was pretty confident that she wouldn't disappoint you. And the second speaker is Eldon Jones. He's a good friend of mine because I had my left knee replaced twice. First time, everything went fine. About 10 weeks later, I had pus in there. I had a bad bug called MRSA. I had to have it cleaned out, new one put in, and I got this put in. So 3 times I went to his place on Webwell and Dressler for physical therapy on my knees, and now I'm happy to say they're fine. So Eldon is a real treasure. He's an MA in exercise physiology and a master's, an MBA in business. And he's Director of Sports Medicine and Offsite Therapies for locations North Canton, Jackson, Lake, and New Philly. He oversees 45 therapists, therapy assistants, athletic trainers that specialize in physical, occupational, and speech therapies for adult and pediatrics. And he's Director of Adult and Pediatric Therapy Service, Sports Medicine, Health and Fitness, cardiopulmonary rehab programs also. He has been around a long time, has terrific experience. He's running a lot of athletic programs. He keeps himself in very good shape. He's one of my role models, but I'm not doing very well. All right, Eldon.
Thank you. How many of you have ever had physical therapy yourselves? Oh, so quite a few. So, and that a lot of times is the case where that's how people first get exposed to that whole field, because I know when I was going through school and such, it wasn't even something on the radar. They existed certainly, but it wasn't something I really had any direct awareness of. But physical therapy, kind of like what Barb said with nursing, it mirrors a lot of the same process that you go through nursing, and the same background you'd want to have as a student. So you still follow the sciences and the math. So all that pretty much is a mirror image as you take your career path through high school and then as you go into the college setting. With physical therapy too, just to kind of broaden your scope too, there's physical therapy, there's occupational therapy, and there's speech therapy too. So there's other therapies that, again, follow similar paths depending on the type of patient you want to see. Physical therapy, obviously as the name suggests, deals with the physical nature of anatomy and physiology, your limbs, your joints, all those things are your main focus for the most part. How you walk, how are you able to walk, getting your strength back, getting your flexibility, those kind of aspects. Occupational therapy is such where it deals with trying to get people to be able to do activities of daily living again. And one of the easiest examples is if a patient has a stroke and they have different deficits now where they can't maybe dress themselves, they can't feed themselves very well, and so the occupational therapist will assist them regaining that strength, regaining those motor skills for the simple tasks that we all take for granted every day, as simple as buttoning a shirt or putting a spoon up to your mouth. So that's their world. And the speech therapist, as the name would suggest, is working on speech. And it's amazing because I also manage, like Dr. King said, pediatric therapies. The speech therapy for children, it's such a high demand, and there's so many children out there that have speech deficits. And again, things that we take for granted and how we make sounds and even the simple thing of swallowing. Some of the children have issues with swallowing, and so the speech therapist can assist with that. So the speech therapist can wear quite a few hats as to what role they play with adults and children. And again, so again, just to give you some perspective of other avenues you can take in the therapy world. Also with therapy, in the therapy world, there's therapy assistants. So the difference between a physical therapist and a physical therapy assistant is really the education you go through. The physical therapy assistant is a 2-year degree. And Stark State here in town is probably one of the better schools in the state, if not in this part of the country. They have a very, very solid program. And again, just as the name would suggest, you assist the physical therapist in performing those exercises, those routines of strengthening and getting gait training. So that's a 2-year degree path that allows you get a license, and then you perform physical therapy under the guidance of the physical therapist. So they oversee your care, and you go to them for care plans so that you know what you should be doing with each respective patient. But it gives you, in some cases, a lot of students will use it as a stepping stone. They'll go, I want to kind of test the waters and see if I like this field, and then they'll go on and get their physical therapy degree. So it does happen that way in many cases. So it does give you somewhat of a starter point. And there's also occupational therapy assistants as well. So those two fields have the assistant option that is, again, only a 2-year degree that might give you an in. Physical therapy, just to stay on that, kind of using Barb's format here, just somewhat, the high school curriculum, pretty much the same path. Math, science, foreign language, all those are the same. Once you get into school, where someone takes a diversion with physical therapy is, the degree now is the requirement, it's a doctorate. And I know that sometimes scares people when they hear that, and oh my gosh, I'm going to have a PhD. Well, it's somewhat along that path, but it's certainly much more school than just maybe 5 years ago. The profession as a whole has added more classroom curriculum as well as real-world clinical experiences. So they've added to that, and therefore they've made it now a doctorate program. In the state of Ohio, there are 10 programs that offer the doctorate program in physical therapy. Walsh being right in our backyard as one of the more local ones. Youngstown State, Cleveland State, Ohio State, University of Dayton, Toledo. There's all schools that provide that doctorate. Yes?
Like which program that's in Ohio would you recommend being like the best?
Well, I don't, like Bart kind of alluded to, the best is what's best for you. And there's a lot of different things that you need to consider when you're looking at any school. Obviously, location, the cost, the environment. I always tell any student, no matter what path you're taking, you need to go onto the campus of the school itself. And sometimes there's just that inherent vibe you get. You sometimes know if you belong there or you don't. And so I think there's nothing like the personal experience versus just reading catalogs or looking online and kind of seeing that they have this degree, okay, I'm going to go there. I think you have to go on campus, get a feel for what that school has to offer, and then make your decision, somewhat using that as part of your decision making. But to say one school is better than the other, again, Barb alluded to the pass rates. The same thing applies to physical therapy as far as them getting their license, passing the boards. In physical therapy, you have a board exam at the end that you will take as your national licensure examination. Same thing applies. So there really isn't a difference in that sense, but I have Walsh graduates that work for me that are my employees, and I can say hands down they're very, very well prepared. I also have Ohio State grads, University of Toledo, and Youngstown State. So locally I have a lot of, basically Ohio graduates that have all done very well prepared. And we see a lot of students, as part of your curriculum with physical therapy, and really all the therapies, it's not just a classroom part. There's a very, very heavy emphasis on clinical experience. So in many cases, you'll do 4, if not 5 different clinical experiences varying in length, anywhere from 4 to 12 weeks long, where that's your classroom. So you are going to get hands-on experience. So it's not just, I know the book stuff really well, but when you go to a patient, you don't know, the right from the left. So again, it really gives you a lot of truly clinical experiences. So that really, again, I think gives a student a great perspective of applying those talents that you learned in the classroom and really getting to practice those people skills. Again, I think physical therapy is probably one of the most people skill type professions in healthcare, because you have people, again, coming to you that are in pain or having some issues, and if they can't relate to you, they're not going to trust you, because when you move their arm that has been broken or strained and it hurts and you're telling them it's okay, if they don't trust you, they're not going to let you do that and let them get better. And so there's that rapport you have to get, and so again, you have to be able to engage them and get them to trust you that you know what you're doing. And that really comes, and those are somewhat intangible things that come along with your experiences to your student rotations. So it's a great opportunity with the physical therapy side that, again, you get the classroom, the traditional classroom setting, but you get a lot of hands-on. And so when you're done with your schooling, you really are very well prepared to go out into the real world and kind of apply your skills. So again, it's a great opportunity on someone's part that feels that they want to relate to patients and be able to help them, because physical therapy, again, it's a great opportunity, and you go a lot of different tracks. Barb gave you the 100 things for nursing. I'm not sure if there's 100 physical therapy ones, but you can go in this. I manage directly sports physical therapy, but it wears more hats than just sports. We don't just see athletes, but a lot of students sometimes think, I just want to work with the Browns, I want to work with the Indians, or whatever, and that does happen, no question about it. But we also have, the weekend warriors, the guys like myself that go out and run and do stuff, and then they hurt themselves, and then you have to get them back to what they want to do. Or people that are working on the job and they hurt the low back. People that have surgery, children. It goes the whole age spectrum. We see kids from 1 year to 99. It truly goes the whole gambit. So you really you can pick your niche, and that's kind of a beauty of physical therapy too. Physical therapy, as a profession, probably only less than a third work in a hospital setting. The majority of physical therapists work outside of a hospital setting. They work in private practices, they work in clinics, they work with government agencies like the VA. So there's a lot of different opportunities with physical therapy, and probably without any doubt, you will find a job in any city you go to in the United States with physical therapy. You will never ever have an issue with finding a job. And as my generation, the baby boomers, are starting to come of age, there's definitely not going to be any shortage of jobs. As you guys get into the profession now, you're in prime time. You're going to be at the right place at the right time, because healthcare in general is going to explode, just with the needs of the people now becoming the senior citizens and all the healthcare needs they're going to have. And people are living longer, and so with all those dynamics, you guys that are picked in the healthcare field will be, definitely riding the wave, because you will definitely have a job waiting for you as you finish your schooling. There's no question about it.
Eldon,
Yeah.
can you speak to the question of salary ranges for physical therapists, physical therapy assistants, and other levels?
Yeah. The assistants, again, due to the schooling differences, physical therapy assistants and for the same occupational therapy assistants, they're making somewhere between $40,000 to $50,000 a year in that ballpark. And again, the thing with that is that's subject to your location. What works in Northeast Ohio and LA would be a whole different scale. New York City, all those things are somewhat, when I say a number, it's more Northeast Ohio based. But bigger cities certainly, in most cases, pay more. And then the coast, west or east, typically have a higher pay range as well. But Northeast Ohio, you're in the mid-40s more likely. PT, you're probably looking at probably $80,000 to start, in that range. Is pretty typical. So again, that's again in our world, in our backyard, that's pretty much a fairly normal starting salary for a physical therapist. Again, realizing that they have a doctorate now, so sometimes there is a little bit of a bump because of all the schooling, but unfortunately it probably doesn't exactly match the extra schooling you have now, but it certainly is a good start. But again, those are all subject to kind of the area you live in. But that's pretty typical for that world. Let me think about other things that Bart covered that again, all the nursing dynamics. There really isn't any advanced practice things with PT. You can get advanced certifications, and that could help you within your job, so that you might get some compensation within your job, or you can get advanced in orthopedics, sports medicine, pediatrics. Those are all advanced practice certifications you can receive, and it's more of a confirmation of competence that you have this expertise, and you could sell yourself to an employer or a workplace that you have more of a working knowledge of this area of expertise, so therefore you can kind of be more marketable and kind of go out there and do your thing. And in a lot of cases, what physical therapists do, it happens quite often, is that you get some experience for a few years, and then you go out on your own. And that's the beauty of physical therapy, is that a lot of people go out and start their own business. You can be your own boss. And that's one of the beauties of physical therapy, is that you can do that. You have the skills and you have the expertise, and they just blend in a little bit of the business side of things, and you can go out and kind of hang out your own shingle and do your own business. And that happens. And there's quite a few in this area, and there's quite a few literally throughout the nation. That is a very, very prevalent pathway that people take with physical therapy, is that you can be your own, and then employ other therapists, and you guys build your practice from there. So it's quite a neat profession. Something that's happened in the state of Ohio, and it's really happened throughout the U.S. Almost, I think there's only maybe 5 states now that don't have it. Patients now can come directly to a physical therapist without seeing a physician first, which is kind of a new trend. They call it direct access. And so you really bear a lot of responsibility, where a patient comes to you and says, my ankle hurts, my knee hurts, my back hurts, and you don't have, in this case, the doctor to kind of tell you what is going on. You have to be able to tell that So that's a lot of responsibility for a physical therapist to do that. And so that practice is out there. It's kind of subject to the comfort level of the therapist, how much that happens, but it's certainly legally an option that you have. But again, it just kind of bears to the amount of expertise that has been given to the physical therapy practice. And so therefore, it really tells you a lot about the expertise and the educational background that you guys go through to get to that point where you can see patients directly without a physician being initially involved in that process. So that is definitely something that's, again, kind of bears witness to telling you that you, again, have a lot of expertise. Yeah.
Maybe you covered this, but just to reemphasize, how many years to become a physical therapist versus a PTA?
PTA is 2-year degree, and now the physical therapist, it's probably pushing 6. Some programs, their formats are different, but they have where you'll go through 3 years of undergraduate, and then the 3 years of graduate, which is, so it's kind of almost like you're going through a partial undergrad, and then you're getting a master's and a doctorate kind of blended in, and they squeeze it all together in a 5 or 6 year span of time. So you're almost all, minimum would be 5 years of college. It's more realistically, it's going to be 6 is the time you're going to be spending. So that's pretty much the window of time, no matter what school you go to, just how they package it. But more likely, it's going to be a 6-year process. Yes.
You said how like some GTs like open their own clinic.
Mm-hmm.
If that were to happen, like how much do you think their salary would raise since they have no?
Well, it could go up fairly significantly, but with that, you have all the expenses now. You have a building, you have equipment, you have to pay for insurance, you have, if you have other employees, that salary comes out of that pot. So the opportunity for increased salary is immense, but with it comes a lot of responsibility. With other now people depending on you as a business owner to make things work. And again, all the, as they call it, overhead, those expenses that come with owning or operating a business. Like in a hospital setting, I don't directly worry about that. I know I'm going to have a building with lights and heat and air conditioning, and I don't have to worry about that bill. But as you, as an individual private, practice owner, that is you have to worry about who's going to remove the snow, who's going to cut the grass, and all those things that in other settings you kind of take for granted, but now they're on your plate.
You got to worry about Medicare, Blue Cross, and all the different insurance programs, and hope that they pay you too.
Right, and so it just there's a lot of other responsibilities, but it's kind of a risk-reward thing. So if you're able to say, I know what I'm getting into, and I think I can make that happen, then the sky's the limit in the sense of the opportunity for salary. Absolutely. I mean, you can make all kinds of money, but again, it comes with the responsibility of, like all the things I said, the overhead and other staff and things that go with that. So you have to wear a lot of hats, and a lot of times what happens with a private practice therapy owner is that they don't get to practice as much therapy because they're doing all the business things.
Yeah.
So you lose maybe some of the things you got in the profession to begin with. You don't get that opportunity now because you have to worry about, paying taxes or, buying new equipment, or who's gonna, fix this piece of equipment. So it's a balancing act. It truly is. So. Any other questions about therapy in general? And another thing, I guess, it's not maybe directly physical therapy, but it's another avenue that people somewhat take, is athletic training, is another one, just throwing it out there, as one that kind of follows a similar pathway. And again, athletic training, as the name suggests, you're working with athletes, but it's working in a lot of the same settings as a physical therapist does. We employ quite a few athletic trainers that work at various schools but also they work in a clinic. So they treat patients just as a therapy assistant does, or a physical therapist. Certain niche of patients, certainly, but again, athletic training is such that is another opportunity that if you would like that kind of world, there's a chance to have another pathway to get into. Usually, and again, athletic training, it's now become a master's program. So that's another parallel profession that might be something on your radar. Yes?
Well, since athletic training and physical therapy are very similar, are you able to be a physical therapist and an athletic
Yes.
trainer at the same time?
Yes, I employ one that has done that. She started out as an athletic trainer and basically went immediately in PT school and piggybacked right into it and has both. So yes, you can do both, and it actually is quite an asset because you know the athletic side of things very, very well, in addition to the physical therapy thing. So her scope is athletes to all types of patients, but she really is an expert on the athletic side when we have athletes that need therapy or post-surgical situations. She's very much an asset because she has that extra advantage of having that degree, having that background. So it's definitely, it's a very marketable combination, very marketable, because you really are truly an expert in that world. So more school, obviously, but if it's something you really like and very passionate about, it would be definitely a great combo.
Do you know approximately how much more school it would be?
Well, if you did the, again, with athletic training, it's a master, so there's 5 years, pushing 6. And with the PT part, you're probably going to have to do at least 2 more years of the PT school to complement the undergrad part. So you're probably talking 7 years at the minimum of school that you're putting in, maybe pushing 8. So yeah, it's almost like going to med school. So it's a lot. It's a lot. Again, it just, sometimes those rare circumstances present themselves that you can take advantage of that, but it's not the normal path, and that's not something that you really need to do, but again, certain people have found the opportunity to put it together, but it's not your typical scenario. More often than not, the students who go through the physical therapy realm, and again, after that, similar to nursing, you graduate, you take your exam, and then you become, there's another somewhat perfunctory exam you take for each respective state, and you become licensed in that respective state, and you're good to go. And then if you go to other states, each state has their own requirements, but more often than not, they're fairly comparable, so it isn't like you have to go through any more schooling, but you have to take an exam and go through some of those formalities. But each state has their own licensure requirements, and you would go through that. So you would have to, if you would go from Ohio to Pennsylvania to Illinois, et cetera, you would have to have a license for each respective state to keep that active. And with that too, you have to do continuing education to keep your license active. Physical therapists are required to do 12 hours of seminars, educational sessions each year for their license to become or stay active. So that's a requirement you have. So, like Bart said, you're always learning. You're always learning, and that's healthcare in general. Healthcare is changing so dramatically every year, and this is no exception. You really have to kind of stay on your toes, and this allows you to expand your horizons and expertise. Any other thoughts or questions that I can help you with?
Thank you, Elton.
Thank you.
Do you have a question?
Is there like shadowing opportunities for physical therapy?
There is. Same as nursing, yes. So we coordinate that through our volunteer service department at the hospital. And in most schools, for you to apply, they require that you put in so many hours. Somewhere, depending on the school, it's usually 20 to 25 hours. They want you to have some prior shadowing experience. So you kind of know what you're getting into. So that's almost always a requirement as part of the application process. So yes, we definitely have, make provisions for students to come through and kind of spend a day in the life and kind of see what it's all about and allow you to see it up close and ask questions and kind of see what the real world part of it. So yeah, definitely would be an option.
So you said like you have to have 20 hours like before you come?
Before you would apply to school
Oh, yeah.
in college.
Okay.
Yeah, not come to us.
Okay.
No, we're giving you those hours.
Letting you work.
That's right, yeah. You just